Many thanks for asking me to come and share my journey of resilience-based clinical supervision. My name's Angela Cole and I'm a clinical nurse specialist for children with intestinal failure at the Royal London. I've been a nurse now for over 20 years and really up until last year had never really received clinical supervision in any size or description. During the first wave of COVID-19, I developed a peer support group really to support paediatric nurses that were being redeployed into adult areas, especially adult intensive care areas at that point. The peer support group really just worked from a checking in perspective and support, and just that continuous support from a team that they were well known to, and supporting them within a team that they weren't very well known to, and learning new skills and developing those new skills very quickly under really hard circumstances. Running the peer support group really did open my eyes to the world of clinical supervision. I've done a lot more reading around it with regards to creating safe space and support, and then was lucky enough to take part in one of the FON's Resilience-based Clinical Supervision programmes in October later that year. The FON's programme was amazing and it came right at the right time of my career really. I was lucky enough to be on a course with some really amazing nurses from all around the country. I was really concerned to start with about the virtual world of doing a course, especially clinical supervision, where there is a lot more of interaction and engagement. But actually the FON's facilitator was great at engaging us all. And I think it was something that we all wanted to be there to do, and it just worked really well, and we've continued to support each other since that time. And the FON's course really did give me the skills and the toolkit, I suppose, to move the peer support group on from just the checking in to more of the whole cycle of clinical supervision, and really offering that safe space for learning as well as the chat. Obviously, you've heard from Giselle the cycle of the clinical supervision that FONs use, and some of the techniques that I learned within that cycle have really fulfilled my clinical practice for me personally, but also for groups that I facilitate. I think one of the biggest things was the mindfulness, and I think if you'd have tried to talk to me about mindfulness before completing the resilience-based clinical supervision module, I'm not entirely sure I'd have been that open and engaging to it. I think when you see it as the whole cycle and actually mindfulness bringing you into the moment, it really has helped. And I had done some separate work with a lady called Bridget Clapham, who's also a nurse and now works as a coach and with Oxford Mindfulness Centre, and we developed an on-the-job mindfulness and breathing technique really for nurses within redeployment and or within clinical situations that they're finding challenging. And it's a 30-second breathing and mindfulness technique, which has worked wonders for me, especially during my own redeployment. The other thing about the FONS course, it really does teach you more about yourself as a nurse and as a leader, and really picking out those items that I think we all struggle with, such as the inner critic, and I think that has been especially important during redeployment for me and people that I've conducted clinical supervision with since then. I think we all have concentrated on the things that didn't go quite as well as we wanted to, the things we weren't quite as good at, that we would really want to be as good at, rather than picking out the more positive things that we were doing on a really day-to-day basis. And I think that inner critic, whether it's just nurses or it just feels that way, but I think we are especially hard on ourselves, especially in circumstances that we find challenging. So I think, yeah, the inner critic and then the positive reframing, finding those hard situations, positively reframing, learning from them, so that you can go in the next day into a very similar situation, but have learned from it and move that situation on, so that inner critic is quietened and your clinical practice has developed and enhanced for patient care. So yeah, from my perspective, the skills that I learned during the Resilience-based Clinical Supervision course really did help me in my individual practice during redeployment. And I have to say, being a paediatric nurse going into an adult, in an adult care world, I was actually able to use a lot of the mindfulness skills and that positive reframing actually with patients when you were sat chatting with patients that obviously were in the same challenging circumstances as you. Those skills were really important to be able to move the conversation on and help those patients deal with where they were sat at that time. Since the redeployment, which carried on obviously into this year 2021, I've been able to engage more than I ever had imagined nurses in taking part in clinical supervision. I think the time is just so apt at the moment. I think we have struggled with engagement historically, but actually people are desperate for a safe space to discover the learning behind what went on during the pandemic, but also then using those skills to actually use clinical supervision as a positive, not just bring in kind of the challenging situations. You know, we do so much good work as nurses, and actually exploring that within team clinical supervision is amazing for well-being, and really working on building those workplace communities so that we can, it comes back to the peer support group. If we can get the clinical supervision going, we can really work on those work-based communities and enhance peer support, which we all know, if we're a good team, we generally are offering good patient care. Right, for me, it's the whole cycle of resilience-based clinical supervision, really working together and bringing the toolkits that we learn in the FONS module really into our practice, into our patients, and then moving that cycle on to group and individual clinical supervision so that it enhances our colleagues' practice as well, and just keep that cycle going. I think one of the biggest hurdles is the time value. As I said, the engagement has been overwhelming for me from nurses that want to take part in the resilience-based clinical supervision. We're finding the time as me as a facilitator, and for those nurses that want to engage in it, is a big hurdle. And behind the scenes, there's lots of work going on to try and find ways of breaking those hurdles down so that we've got an equitable sort of resource for clinical supervision. In a nutshell, my journey of resilience-based clinical supervision is still continuing, and I really hope that I get the opportunity for that to continue really throughout all of my nursing career now. I think I've had over 20 years with no clinical supervision, so the real project now is to make sure that continues through my career, but also it becomes just part of the standard nursing practice that we all engage in clinical supervision. Both our clinical development skills, as well as then our patient care and those work-based communities for the health and well-being of nurses. So thanks.